pieces, what we're really expecting from you guys, and what you can expect from us.
So I kind of alluded to this thing called a driver diagram earlier today, and so this is what I was really referring to, and this was one of the main things that came out of the working group that got together in July, and you should have a copy of this in your packages, because the writing on the slide might be a little bit too small for you to read. And so what we went through was some exercises to develop the aim statement, which Rolando touched on earlier, and then what the driver diagram really does is identifies what are the key categories, which are the primary drivers, that impact our ability to actually achieve that aim. And then the secondary drivers is a further breakdown of those primary drivers. And definitely not exhaustive, but some of the key things that would impact. So, for example, we're talking a lot about engagement and retention in care. So if you look at that, the primary driver, the very last one we've got there is engagement, as a really key thing that can impact on most of those aspects of our aim statement. And so some concepts that kind of fit into that engagement, you know, some of the things that have been coming up that we don't even have on this driver diagram is our waiting room, the front desk staff, how people feel when they're accessing that space. Other things that we have in here is the patient medical home. Is that person getting comprehensive care when they come through the front door? Trauma-informed practice and cultural competency. Are people feeling that safety in our spaces? So this really can act as a resource just to kind of help ground, you know, in your teams, do you want to look at some of the education pieces? Do you want to look at some of the engagement? Do you want to look at the opioid agonist therapy pieces? And this will feed into the work we do later in the day, and some of the content that's in the change package that you guys have on your tables there. So now we're going to talk a little bit about, so this driver diagram is fairly abstract. So how are we actually going to accomplish this, and what are we going to do as a collaborative?
Great. So some of you may have seen this diagram already, and I apologize, a little bit light on the screen there, but the way we're going to approach this collaborative, as was mentioned already, is using the Institute for Healthcare Improvement's Structured Learning Collaborative. You might also hear it referred to as the Breakthrough Series Collaborative, and those terms can be used interchangeably. But it was, you know, a framework developed to close the gap in healthcare between what we know and what we do. So as was mentioned again today as well, it was used for the Stop HIV Structured Learning Collaborative, as well as the Continuum of Care Collaborative, and some of you may have been involved with that project. I see some nods, or may just be familiar with it. So what it does is it creates a nice structure from within which interested organizations and teams can work together towards a common aim using a set of common measures. And you know, a big part of this approach is using collective knowledge. So again, this has been touched on. There's so much knowledge in this room, and there's probably a lot of things that certain people don't know that others are doing that would really benefit them. And so what we're really trying to do is create a space and create an opportunity where you can learn from each other and you can share your learnings with other people, treating the same clients, you know, all the clients that are touching down in the different programs in Vancouver. So there's some key elements. We've broken the Structured Learning Collaborative into three sort of main areas. The first was the preparation phase. This is where the gap in care was identified. As Danielle mentioned, we brought a working group together in July to develop sort of the meat of the collaborative. That's the change package, the aims, the drivers. And now we're here. Participants have enrolled, that's you guys. And the launch is running now, and then we'll move into a series of in-person sessions every 3-ish months. And sort of in between those periods, we'll have action periods where you'll actually be testing change. You'll be taking what you learn at these sessions and implementing it into your practice and measuring it. One thing that we won't directly be developing through this collaborative, but we're hoping to influence, is creating a community of practice within Vancouver. So creating connections and linkages between all the different programs so that you have this network of people that you can rely on and ask questions to as we sort of move out of the sort of intensive phase of the collaborative. So as I said, we have 3 in-person learning sessions. These are going to be opportunities for everyone to come together, share your ideas, network, learn from each other. Our first learning session is going to be in December, so the first week of December. There are dates here on the bottom. Those are to be confirmed shortly, but these are sort of the dates that we're aiming for. We want to focus in on some of those 3 focus areas in the first learning session, really make sure that you're feeling supported in the ideas that we've given you and in the measurement piece as well. The second learning session is going to be in the middle of March. At that learning session, we're hoping to focus on spreading change, talking more about the client engagement piece. One thing that's come up a lot is chronic pain and opiate use disorder. Noah, we've put up some topics here, but we want these sessions to be as impactful as possible for you and your teams. So we'll be asking you for feedback on the evaluation today. What are those specific topics that you really want to learn more about? How can we make these days the most useful for you? And then our final learning session is going to be in June of next year. And this is going to have a focus on sustaining those improvements that we hopefully will have made and sort of celebrating our successes and looking at some of the other therapies that we haven't directly influenced in this collaborative, such as injectable therapies. So the action periods, we had a preparation webinar at the end of August. And hopefully some of you attended, and if you haven't watched the recording, it's on our website, and I would encourage everybody to do that. It really gives a nice background on what we've talked about today. And then our first action period is going to start on Monday. So this action period, we've set some overall objectives for you guys, but you're within these overall objectives that we've set, you and your team are going to decide what it is you want to work on and make those really specific. So we want to focus on testing change on a small scale in this first action period, really optimizing that measurement piece. When Danielle and I are done here, Cole's going to give us an overview of how that's going to work. I know that we've been talking about that, and some of you may be wondering how that's going to work, and we do have a plan, I promise. And really working on team engagement, so defining the roles and responsibilities in your quality improvement team. Who's going to do what? Who's responsible for what tasks? And the second action period will run from December to March. In this phase, we're hoping to get you guys focusing on adapting these changes for spread. So you may have practiced a couple changes on 3 or 4 patients. So what is that going to look like if you expand it to your whole patient roster, or maybe 15 patients? Again, optimizing that measurement and reporting piece, and really building relationships among the different teams and then also community organizations. We have, again, some ideas for educational topics, things like trauma-informed care and cultural competency, but again, these aren't set in stone, and we want to hear from you as what's going to be helpful for you. And then the final action period will run from March till June, and this will focus on really seeing results in those process and outcome measures that we're measuring, maintaining that momentum, and really looking at some other pieces that maybe we haven't touched on yet, and really developing that opiate agonist therapy prescriber or clinician community of practice so that you guys, once this collaborative is over, feel supported to continue this work forward.
So just to briefly touch on the measurements and the reporting, what's going to happen. So as we've kind of alluded to, and we'll keep going back to this throughout today and throughout the collaborative, is our 3 key focus areas of diagnosis and treatment initiation, treatment retention, optimal dosing, and quality of life and bundle of care. We've been saying bundle of care, just to clarify, that's kind of looking at the bigger picture for someone's health. So that could include things like HIV testing, Hep C testing, access to take-home naloxone kits, and basically looking at the more holistic health of that person. So, sorry, it's been like a term that we've been using without actually defining it. And so what's going to happen is there's some metrics within each of these categories. There's a few required ones, and then there's also some optional ones. Cole's going to go into more detail around that, and what that really means is we're going to be looking at what metrics are actually feeding into our aim to evaluate it, but then for some of the small scale changes you're doing at your teams, there might be smaller kind of things that you want to measure to see if that change is leading to an improvement. Those are kind of what we're labeling as an optional metric that might show change in a shorter time period. Another thing that we're going to look at having feedback on is what we're calling a team narrative. And this is a really meaningful feedback method in terms of numbers are great, but the team narrative gives us the context behind the numbers. And it tells us, why maybe a certain change isn't leading to improvement, or is there something in the system that is preventing you from making improvement in a certain area. And talking about what you're planning on doing next. And so it's a bit more of a qualitative feedback to us so that we can hear about what's working, what's not, where are you going with what you're doing. So reporting is going to be coming to our core team from each of you on the last Thursday of every month. And so the first report is going to be, that you're going to be submitting, will be on October 26th. And then when we get that information from you, we'll then be kind of collating that information in order to have a more overarching report on how is the collaborative going, how are we doing with our goals, so that we can report back to you how the bigger picture things are moving forward. A few other things to think about for during our action periods are the ways that you can get support. So we are going to be hosting some webinars and coaching calls in between the learning sessions. And so, as Laura said, we want to hear from you. What kind of topics are you wanting to hear about, learn about? We really want these to be the most meaningful that they can be for you. As we said, we've got support from the Practice Support Program, or PSP. In the 2 weeks after this launch, hopefully your contact at PSP will be reaching out to you and meeting with your team and helping you refine what your team aim is and setting you up for how you're going to move forward with starting to test changes and measure those changes. Also, most of you have probably signed up for our listserv. And what we really want to emphasize is, so far it's been a bit of a one-way communication that we've been using to get information to you. The intention behind this is actually for it to be a two-way communication, or even a multi-way communication, where you can actually reply to the entire listserv. And so if when you're trialing a PDSA cycle and you find, you're having something unique come up and you're really not sure why something isn't working, or you're not sure of a creative way how you can maybe face that challenge, that you can send that question out to this group and get that feedback and that knowledge from everybody in the room, even when we aren't in the room physically together. So we really want to encourage people to reach out to everyone through that modality and that email. We also want to touch on that we do really value expert faculty. It's been wonderful having Dennis working with us in the lead up to the launch and to be able to join us today. We also want to, along with the webinars, we're going to be recruiting expert faculty to provide feedback and provide expertise in areas that we feel like we need to pull people in on. And if you have any recommendations, please approach us. Please let us know. And we're very excited to get this all going today.
Mm-hmm. All right, so the final thing that we're going to touch on is the key resources that will be available to you and your teams throughout this process. So you'll see on your table, one of them is there, and that's the change package. But the four main documents that will be your go-to resources for the collaborative. The first is the preparation manual. This is a document that sort of goes into more detail about how to get ready to be a participant in the collaborative, how you can organize your team, set yourselves up for success for measurement. This sort of is an extension of the preparation webinar. So if you can view the webinar and then have a look at the preparation manual, there's a ton of information in there to help you guys get set up. It's not in your packages today. It's available online. We're trying to save trees. But it will be available in PDF form. If for whatever reason you can't access documents on the website, just email Danielle or I or Cole and we'll get you a copy, whether that's electronically or a hard copy. The second document is a navigation booklet. This is just sort of your reference guide. It tells you where to look for what information, so where you can find information about measurement, about defining your population of focus. The change package, which is the one on your tables, that's sort of your starting point for change ideas. So we've worked hard to try to develop a comprehensive list of ideas, but by no means is this an exhaustive document of ideas. We want your feedback. If there's something in there that you've tried and works and you feel other teams would benefit from, just let us know. I will say that all of these documents are living documents. Even though they're in PDF format, we can change them, we can add to them. They will shift throughout the collaborative, so we welcome your feedback if you're going through any of these and you have ideas and thoughts. The last piece is the guide to measurement, and so this is going to be your resource and tool for more information on how to pull those quality metrics, detailed definitions of what the metrics are, and what we're hoping to get out of those metrics.